Welcome to another episode of The Disruptors, where we're arming you with the tools you need to innovate within the physical therapy space by highlighting those who have come before you. I'm your host, Stephen Cohen. Now, let's get into it. All right, everybody, welcome back to another episode of The Disruptors, where we're highlighting innovators within the PT industry in order to give you bite-sized and usable tactical advice to take forward in your innovation journey. Today, I'm blessed to be joined by Tony Maritato. Tony, would you please give folks who somehow don't know you or of you a brief intro, and then we'll hop right into it.
Sure. Thanks, Stephen. So, my name is Tony Maritato. I'm a private practice owner. I'm a physical therapist. My kind of claim to fame that makes me a little different. I actually owned a physical therapy clinic before I became a physical therapist, but I came out of South Florida, Sarasota specifically. I love physical therapy. I still treat patients, but I probably love the business of physical therapy a little bit more.
Oh, I love that. We're going to have to dive into that. I've thought about potentially going back and maybe even becoming a PTA after this is all over. I don't think I have it in me to do the DPT. I think I'm done with that level of schooling, but maybe we'll save that for later.
Sure.
Okay. Oh, so much to get into already. So why physical therapy? Like, how did you get into owning a practice? What was that journey like?
Yeah, I remember growing up as a kid, I loved being active, but I was never into sports. So I was an only child. I never played any organized sports through high school. I was in the visual arts and performing arts programs. So for me, being active, hang on. So sorry. Being active was really like my main thing. And so I graduated high school. I fell in love with martial arts. I was doing Muay Thai and Kali and Jiu-Jitsu, and I was traveling and I was teaching with my professors. I spent probably a decade just full time into martial arts. And at some point I said, I want to open a martial arts academy. That got me to say, hey, maybe I need a bachelor's degree. So I got a bachelor's degree in kinesiology. I've always been driven by like, what am I doing right now? And how can I do the next level of what I'm doing? So while I was in school getting my bachelor's degree, I was introduced to physical therapy, fell in love with it, and then worked for a year at an outpatient hospital physical therapy clinic as an exercise tech aide. And I remember talking to the director and I was like, hey, how do I open a physical therapy clinic? I want to own a physical therapy clinic. And of course, he gave me the story, great guy. I love him to death. But he was like, well, first you have to become a physical therapist. That's, 7 more years of school. Then you start getting a job. You work for the hospital. You meet the doctors and then you open your own practice. I was like, no way. I am doing this. Within probably 3 months of that conversation, I quit the hospital, got a little personal training studio on Siesta Key, started doing personal training, recruited a physical therapist, and I convinced her to just give me 3 months to start a physical therapy practice in my personal training studio. Now, 24 years later, she's been my wife. We have 4 boys. Like, we've grown the practice to 5 locations. We've done so much, but that's kind of how I got into physical therapy.
That's an amazing story. And a lot to unpack there. I really appreciate how you heard the, hey, do this for 7 to 10 years and then think about it, and just said, nah, I don't think so. I think there's a valuable lesson there, but I want to go back to a bit before you said something that I think is extremely valuable, which is this mindset of how can I continue to do that? How can I do this at the next level, and keeping that in the forefront of your mind. And it sounds like you have created a framework in your mind that just thinks about, okay, like incremental steps and improvement, which feels much more achievable versus, okay, well, if I want to be here in like 15 years, how do I get there? Right. I think, I don't know if it's Musk quote, but people typically underestimate what they can get done in a year and overestimate what they can get done in 10.
Yeah.
And I think that you have lived that based on your trajectory. So, how did you keep yourself grounded to just focusing? And I say just with the air quotes, right? Just on that next step.
I think you have to love the process. You have to love what you're doing. So for me, the goal doesn't really matter. It's what am I doing right now? Am I having fun? Am I enjoying this? Am I learning? Am I growing? And you start to realize there are some universal truths that just pull through everything. So whether I'm starting a physical therapy business, I'm treating a patient, I'm learning how to speak a new language, it doesn't matter. It's, do I enjoy what I'm doing while I'm doing it? And am I motivated? Am I pulled to doing the next thing, as opposed to am I forcing myself to do the next thing?
I think it's really valuable. So if I'm breaking it down into a framework, which I've been trained and I'm not going to unlearn that from my days in consulting, right? So you have to love the process, and the way you think about that is breaking that down in: do I enjoy this process? Do I love what I'm doing? Which maybe pretty similar. And then am I pulled in this direction, right? And so I think as folks are listening and thinking about trying to find their thing that they want to go and expand upon, I think that's a really good set of questions to really boil it back down to two, right? Do I love doing this process? And am I being consistently pulled in that direction? Which really probably is one, right? Do I like or do I love doing this? And if so, then maybe I need to figure out how to do more of it, right? And that's it. That's Wow, we're 5 minutes in and, and already have a really good piece here. So I'm excited about the next the rest of the time we have together. So you started a practice by recruiting a PT who is now your wife and four boys. That's got to be. I'm sure you've patched a hole or two in the wall in your day. Maybe a window or two if your boys are anything like my brother and I were. Um, and so, which is just a whole other conversation. I'm sure we'll have hopefully in person sooner than later. Um, Talk me through that sales process, right? Because, and I know you talk about this a lot. Every PT is in sales, right? Whether you want to be or not, you're in sales. And sales is a very general term. I think it gets a bad rap, to more of like people automatically think of a used car dealer, right, versus a selling someone on a better version of themselves, right? So as you were recruiting patients and ultimately a provider as well, like how did you build that sales process, or just what was it like? What were you selling, and how did you come to that?
Yeah, I think most therapists can agree. Why did we become therapists in the first place? Because we want to help people. The best salespeople are the people that help people the most. I've never, from the first day in business till now, I've never been in a situation where I forced somebody to buy something that I didn't think was in their genuine best interest. And that's what's so beautiful about being a therapist and being a salesperson, being a parent, being a teacher, being any of those things. You are honestly in a position to do what's best for the person in front of you. So when somebody comes to me with shoulder pain, I'm not trying to talk them into doing something that is opposite to what they want. If they want to feel better, it's my opportunity to give them the resources, provide them the opportunities to do what they need to do. So if that means buying a plan of care, that might be $3,600. If that means getting a Medicare covered benefit that they've paid the premiums for their entire working life, that's an opportunity too. So for me, sales is really just my chance to help people achieve their goals, whatever their goals may be. I'm not here to judge what the goal is, if it's worth it or if it's not. And from a financial perspective, obviously, I've come to realize over time, I think this is a Zig Ziglar quote: you help enough people get what they want, you'll get what you want. So the better I can help people achieve their goals, I'm always going to be provided for. But that's really the root at where I approach sales. It's how can I get you what you want, what you need? Do I have the capacity to do that?
I like that. And there's an accelerator we went through called Techstars. Their one of their mantras is give first, right? And in a way, I think the quote you just gave and that are directly tied, right? Is like, how can I give something of value first and just have hope, right, or a belief that it will get returned to me, and at minimum at a 1-to-1, but most likely at a 2 to 3 plus to 1, which is what's called profit, right? At the lowest base pedestrian level. I appreciate that, and maybe that's worth a quick tangent, right? And do you think there's something here on why PTs, and I'm going to generalize, but why PTs don't like selling so much is kind of back to that first part, is they're not passionate about what they're selling. Do you think that is a key piece of or a key driver of this adversity to the sales process in the physical therapy world?
I don't know if I'd say they're not passionate about what they're selling as much as I would say they're insecure about what they're selling, or they don't feel like they're really selling a solution to the problem. And I can totally empathize with that because I deal with that every single day. I'll give you an example. A patient comes in this morning. This was an individual that verbally is telling me, I want to be stronger. Okay. That makes total sense, right? I want to be stronger. I want to play with my grandkids. I want to throw a football. But I kind of know the second layer of that is I want to be stronger as long as I don't have to lift weights, I don't have to sweat, I don't have to pay a copay, and I don't have to come work out. Like, so it's not really that you want to be stronger, And in my physical therapy clinic, my personal philosophy, the stuff that we learn in school is nice, it's handy, but the real value is building rapport with the patient, helping them understand the journey, where they're going, where they want to get to, and then really coming up with, a vehicle that not just will get them there, but will get them there in a way that they want to get there. Right. I want to go to New York. Well, I can ride a bike, but I don't want to do that from Ohio. I want to fly. So for us, I think most therapists realize our patients are, unfortunately, they've been living a sedentary lifestyle. They have multiple chronic conditions. They're dealing with diabetes and obesity and hypertension and all of these other things. It's like the house is on fire and they're worried about a candle that's lit in the kitchen. We have a whole lot of other stuff that we have to deal with. So from a therapist perspective, we're looking at it and we're like, realistically, is 3 visits at a $50 copay going to be what this person needs to achieve their goal? Not a chance. So you feel bad because that $50 copay is more than the patient really has available to spend in some cases. And none of us want to waste their money on something that we know isn't going to achieve the goal that they want. So you don't have that confidence. And that's where I think the difference between being in control, being the professional, being the practice owner. When I became a practice owner, I said, look, people need to exercise. They need to move. They need to work out. Can I build a vehicle that allows my clients to do that, that also is affordable? I want to make money, but I also want to make this accessible to everybody. So for a long time, we've had programs where $100 a month, unlimited physical therapy, come in as much as you want. Anything that you need, I will get it to you for $100 a month. We can do that because we were able to make our money in other ways, leverage other assets, do other things that allow us to provide that value to the consumer. And I felt good as the therapist because I knew, okay, I'm not promising you an end to low back pain. I'm not promising you're going to win the next Olympics, but I'm telling you, you're going to get more fit and you're going to feel better, and that's what I could deliver for $100 a month.
I there's a lot of good to great in that. I want to highlight one specific piece, right, which is the value in building the relationship, right? Because you don't get to that second level unless you build that trust and that relationship. And I mean, of course, we're biased, right? I mean, that's what we focus on here at SaRA Health. So, bias with, massive, mountains of salt, right? Not just a grain of it. But I like that because you're right. If you only get to that top level of, oh, I want to play with my grandkids, or oh, I want to get stronger, or oh, I just listened to a podcast and I'm worried about falling and breaking my hip, and the mortality rate associated with it, right? But unless you're building that rapport and that relationship, you're not going to have that trust with that patient to get the truth, right? That kernel, which is, oh, I'm worried about this, but I don't want to walk in my neighborhood. Like, okay, that, like, right, like that is going to help you design something like, okay, now I can use what I learned in school. It's almost like an unlock, right? Like, you don't get to use the scientific, the care delivery piece of what the clinical piece of what you learned until you establish that relationship first. And I'm not a clinician, so I'm get over my skis a little bit here, but in these conversations I continue to have on a daily basis, like, that seems to be the real nugget is you have to earn the right to that data from the patient.
It's totally true, and it's funny because I'm officially a physical therapist since 2006, practice owner since 2001. I've been in the profession. I was a strength coach, personal trainer before that, so I've got a lot of years behind me working with individuals in, I would call it, a vulnerable position. And so therapists, if they ever watch me, I do a lot of like online education, stuff like that. They generally hate the way I do evaluations. And it's a very different approach to an initial evaluation than we learn in school and than what most therapists do. But the piece that they miss is the patient who's coming to us, they've already gone through a series of failures, right? Whatever it is, neuro, ortho, it doesn't matter. My back hurts. Okay, I go see my doctor. My doctor can't help me, sends me to the orthopedic. The orthopedic can't help me, sends me to, the chiropractor, the massage therapist, the medication. Finally, I get to the physical therapist. I haven't had the best of the best in my mind answer or have a solution for my problem. Why is this physical therapist going to have a solution? I've failed at every step in the process to getting this resolved. So for me, recognizing that, I'm like, okay, hey, let's come in. Let's get an easy win under your belt. Don't worry, in my admission process, I don't have them fill out any paperwork except they give me a signature because I'm required to get a signature to accept assignment and to do a couple of things from a compliance and privacy perspective. They give me one signature. They don't answer any health questions. They don't do anything. And literally from the minute I see them pull into my parking lot, they almost never sit in a chair. They don't wait in the waiting room. They come in, they give me my signature. I'm talking to them at the reception area and we get started with exercise almost 3 minutes into it. Because I'll get all the information I need as we build that relationship. But the most important thing for me is that you come in here as a patient, you feel good, you feel confident in my ability to help you, and you leave feeling better than you walked in. That's all I care about. And if I can accomplish that 3 sessions, 5 sessions, 10 sessions down the road, then I'll start to really get to the insecurities and to all the stuff that's been holding you back. And the stories we hear from patients are amazing, but they're never going to release that information on day number 1 because they don't know me, they don't like me, they don't trust me. Nobody else could help them. Why am I going to be the one that helps them? So I really have to work hard to build that trust and rapport.
Thank you for listening to this episode. This would not be possible without the sponsorship of SaRA Health. SaRA is the relationship operating system for physical therapy practices, driving better patient outcomes, improved arrival rate, and improved financial margins. If you'd like to learn more, check them out at SaRA, SaRA Health.com, SaRAHealth.com. And if you'd be interested in advertising with us and helping us produce even more great stories, please let us know at Steven@SaRAHealth.com. Now, back to the episode. I want to highlight the process piece, right? And I'm sure you do this where there's a negotiation tactic where you let the sale basically take the wind out of the sails of the argument against, right? And so if you just simply state and label and name things like, hey, Miss Smith, I'd imagine that you've been to your PCP, your ortho, you've maybe even done some imaging. And so it's not really that $50 copay is expensive in a silo. It's expensive in the context that you have spent $2,000 and somewhere around like 3 to 4 months of lead time across the other appointments you've been to and procedures and diagnostics that you've undergone to get to the point where we're here today, right? Now there's a whole conversation around going direct to PT, and I know direct access is, yeah, I think it's all 50 states now. I think an owner I was talking to last week was joking. They're in Mississippi, that Mississippi passed it first. Alabama passed it right after, but put it into practice first. It's like this joke of like Mississippi needs Alabama and Alabama needs Mississippi, for that reason to be last and second to last in these types of things. But I think it's a really, really important detail just to arm PTs and really any provider with, is like understand the context of where that patient's coming in, and that's just going to fast track the relationship, right? Now that's very different, right? If Miss Smith maybe relocated to Ohio, right, where now she's being seen by you, but she came to you for, like, she knows direct access, she's had good experience with PT, and there was never a question in her mind. It's a very different way to have that discussion than Miss Smith, who has had $2,000 in out-of-pocket expenses and has already hit her deductible for the year. So she's not really thinking about it in the same way that a patient who is a return patient, right, would present from a more that psychological, the biopsychosocial model and the psychological perspectives. Wow, yeah, we could spend almost too much time there. So I wanted to move past a little bit. So we talked about why PT and a little bit about your why for doing what you do now. But as you have transitioned to not just helping patients but helping other practice owners, right? What is driving that passion to be what I see as a proponent and I don't know what else to call it besides just an upper, right, to the tide that is raising all boats. What's driving that?
Yeah, great question. I think it's one of those things where I look at the profession as a whole, and I see a lot of frustration. I think we all do. Therapists want to earn more. They're under more compliance and regulations. They're under pressure. Inflation is going up, but salaries are staying down. And when I look at it, I think, what can I do? What value can I offer? It's the same for my patients, right? How can I help you? How can I help my profession? How can I help? And the story I go back to is I talked to my son. He's 15 now, but I remember when he was 9, we talked about what dad does as a job and a profession. And I said, hey, I want you to think about this for a second. If I'm working in the clinic treating patients and I'm helping people get stronger and healthier, I can really only see maybe 10 to 15 people. I see them a couple times a week. That fills up my entire week. So at best, let's say 15 people on active caseload. But if I hire people, well, now if I hire 10 other therapists who potentially are better therapists than me, that's 10 times the number of people that I can directly help, because I help the therapist and then they help the patients. And I'm like, expand that even beyond that to, what if I put out free content? What if I help other therapists find independence, increase their income? The best thing I can deliver from my personal experience is helping them become better business owners and become more independent, and then letting them do what they do, the magic they do for their patients. And that's really what keeps me going more than anything. I never went down this road because I was thinking I'm going to be a guru or a consultant or any of that. And still to this day, I don't coach. I don't do any consultations. I don't sell my time in that way. I do teach a little bit, but my main thing is to kind of push the ideas, help therapists understand where the boundaries are, what they can do, because we're still so conditioned to think, well, 2 times a week, that's what everybody does. That's what everybody needs. That's what everybody should do. And really, no, like, yes, insurance reimbursement is a component. It's a resource we have available. But there are so many other things that aren't covered by insurance that are important to patient care. So let's act like the professionals we want to be, and let's see the big picture, eliminate the barriers, and create a plan that's perfect for that patient sitting in front of you.
Uh, there's a direct tie to how we think about SaRA Health, which is giving practitioners more time to care. Right?
Right.
That's it. It's giving them more time to care. And I think what you're doing is giving that same time, and maybe actually more broadly, you're giving freedom for practice owners to care in the way that they want to, right? And so that could be freedom of thought in terms of, hey, you can do this, right? Like just even the confidence of, hey, if you are the shoulder place, right, and you know that and you're the best at it, don't be afraid to dive into cash pay and other models to be able to affect more people at a deeper level, right? Or just even, hey, here's how you can treat for a few fewer hours or maybe not at all, depending upon the practice owner, and still make it work. And here's the freedom to have that confidence and do that. And I'd imagine to cut ties with a payer or two, should the economics say that you should. So I love that, and I don't know if you would describe it that way, but as I'm hearing it, right, that your goal is to give freedom to care the way they want to practice owners across the nation and potentially even internationally as well. I'd imagine you have a couple folks from either across the pond, or our northern or southern neighbors that also have found value in what you're the knowledge that you're delivering to them.
Yeah, freedom is the perfect word. I mean, we want to deliver freedom to our patients so that they can walk and they can move and they can do the things they want to do. And we do that through building extra capacity. You want to lift something, let's make you stronger than you need to be. So when you lift that thing, you can lift it without getting injured. And it's the same thing for other therapists. We want to protect that passion to treat because it's not as common as we would like it to be. And if you want me to hate something, tie my livelihood to it. Like I love cooking. You and I have talked off camera about food and nutrition and cooking. I cook every meal every day. But if you want me to hate cooking, make me a chef in a restaurant that I own. And when I have to cook to pay the mortgage, I will very quickly start to hate what I do. So for therapy, I protect my passion to treat by making it separate from my financial obligations. I don't want to treat for 3 more minutes to get one more billable unit so I can pay my mortgage. I want to deliver what I believe is best for that patient, completely independent of financial ties. And so when I teach and talk to other therapists, I'm like, look, there are so many ways to make money. We are in the most prosperous time ever in human history. We just have to understand how we can bring that abundance into our lives.
That abundance mindset is so valuable, right? And there's a book that I really like, which I'll ask if you've read. It's called The Happiness Advantage by Sean Achor.
No,
Have you read that yet?
no.
Okay, I'll send you a copy.
Sure.
And it one of the key pieces is around the abundance mindset, and to especially to your point today, the barriers to entry are so low in comparison to what they were, right? If you came up with a new device, even if it was a new, like, you think of the peanut, right? Two lacrosse balls taped together, right? You can put that on Amazon within a week, right? You could get it designed by someone. Heck, you could probably even use ChatGPT to somehow create the initial design, very low cost, and to at least start testing it, get it 3D printed. Like you maybe $1,000 all in, and you can start generating some results from even a physical product, right? Like that's an insane statement to say, hey, you could be 4 digits or less invested into something like a piece of physical product, and you're out there in market. Like that is wild. You can sell it on TikTok, right? Or Shopify. So I really like that point and want to highlight the barriers that have evaporated in the last 5, 10, 15 years, and agree. Like there's a ton of people that are looking for answers at the patient and even like non-patient level. Yeah, you can look at the total addressable market of physical therapy in the U.S. is roughly like $40 billion, right? But then you look at the broader wellness market, and it's topping $1 trillion with a T. And so, is there space out there? Yeah, there's like 30x the space out there that there is even within treatment. And so there is not only reason to have an attitude of an abundance because of the positive externalities that will result in your life. I believe, and the research would support, but even just looking at the sheer numbers of it, like only 1 in 10 people get PT that should. And then Medicare, the reason they came out with the remote therapeutic monitoring codes is they believe that only 1 out of 100 Medicare beneficiaries actually complete their plan of care like they should in physical therapy. Like that's why they came out with the codes, is let's throw money at the problem. That's basically what it was. And I think we're seeing some really cool, innovative models coming out as a result of that. But that's not what we're here to talk about. So I want to come back to my favorite question to ask, and I think I'm glad I'm asking this early because I feel like this is going to be a good bulk of discussion. Tony, I can give you a magic wand. You can fix one thing within physical therapy. What do you fix?
I've been asked the question before, and I'm a big believer in personal responsibility and accountability. And so I think really it has to come back to fixing ourselves, like fixing ourselves, the individual therapist, our perspectives, our vision. We go in so naive and we want to accomplish so much. But then between the conditioning we receive through schooling, the conditioning we receive through employment, is somewhere we get lost and we fall into the system and we just go with the current. So if I had a magic wand to wave, I would literally bring that naiveness back. And I would say, look, why did you go into this in the first place? To help people. Okay, awesome. Now take all of the knowledge, all the experience, all the information that you know and you have, and without boundaries, how do you create the patient care experience that you want to deliver? Like forget who's paying, forget what they're paying, forget all of those things. How do we make this work? And that's that level of naiveness, I think, is important to bring back. Like kids are amazingly creative. You give them a paperclip, they're going to give you 250 things to do with that paperclip. You give that same paperclip to a college educated adult and they're going to have one thing. It's going to hold a piece of paper. So I want to bring back some of that creativity that I think we've just lost. Plus, I mean, let's be real. We tend to be more analytical by nature. We tend to be more by the book. It's yes, no, black and white, right and wrong. And we know that life isn't like that. So let's bring some of those shades of gray back in. Let's allow ourselves to think a little more freely. And I think we can innovate on what we do and create some really amazing opportunities to help patients at scale in a more affordable way for them and in a more profitable way for us.
I think that's so valuable. And again, I'm biased here, but SaRA Health was my first venture into the healthcare world. And I think that naivety was limiting until it wasn't, right? And we came into it with hey, we want to bridge the gap between visits. We want to create continuity between visits because either of the co-founders, 2 of us as frustrated patients and 1 as a frustrated clinician, right? Like this has got to change. We need to make this better. And you know what? We were in a way wrong for 4 years, 4 very, very long years, where we believed incorrectly that if we created something great for patients and providers, it would be adopted at scale. And we were wrong at that last piece. We didn't bring in the additional financial piece of it, right? But when you think about it in that pure of terms of, okay, let me just do something great for patients and providers and see what happens next. We did find a nice little niche in these groups that had direct contracts with employers, and all they cared about was, hey, we just want to deliver the most care in between visits as possible because we don't get paid per visit. So if SaRA Health can help us engage and activate patients to do what they know they should be in between visits, we all win. And then we were wrong about the at scale until we weren't. And all it took was I guess slight slash monumental, right? You could depend on how you decide to describe it. Monumental shift and a change of reimbursement, and all of a sudden, right place, right time, and everything is off into the races. But I think you're spot on with give yourself some time to be naive again, right? I think that is that is a takeaway. Um, and I like the framing of it. To give time for night in your exact verbiage of naivety, right? Give time for that because if you don't, you're going to be stuck in your local maximum, right? And there's a design principle in software primarily, but it can be adopted really anywhere, which is if you don't unburden yourself, your mind from the constraints of your current system, then you're only going to be able to innovate to a certain local maximum, right? Versus if you ask, well, what if, right? What if insurance did pay for this? Like, oh, okay, well, then it would look like this. Like, okay, well, maybe we get ready because that might happen, or we go attack it in a certain way to be able to make that future a reality. Um, I oh that I think that in terms of takeaways, one from earlier, you have to love the process, right? And be pulled by passion into what you're doing, right? And it doesn't have to mean that you go your path, right? The Tony path of, hey, I want to help more practice owners and more clinicians be able to succeed and be this rising tide that raises all boats because you see the frustration and you want to fix it, right? That could be, hey, I want to help people. I want to help the same number of people, but do it at a deeper level. There's a ton of value in that, right? It doesn't matter whether it's breadth or depth, whatever it is, let your passion drive you into that. And then the second is give time for naivety. I think that is just such a just a beautiful, beautiful, simple statement and framework for and hopefully a push for someone listening. Give yourself that time, right? Take a walk in nature and just unburden yourself from the system you're currently in. And it's like, what if, right? Ask the question, what if? So, Tony, I appreciate your time so very much, and I think those two pieces of advice are excellent tactical takeaways for those listening to be able to hopefully make innovation just a little bit more accessible and help them think through like how they could expand their impact.
Awesome. Thank you.
Well, how can people find you? How can people connect with you and learn from you?
Yeah, I'm super accessible. You can find me under Anthony Maritato on Facebook, on LinkedIn. I've got a YouTube channel, Learn Medicare Billing. And really, I'm an open book. I mean, my main value is I've made all the mistakes I can make in the last 23, 24 years. And I'm happy to share those lessons with anyone so they don't have to make the mistakes to learn from them. They can learn from the ones I already made.
I appreciate that. And we'll make sure that those links are available for when we push this live. Tony, any other pieces of advice or anything before we sign off?
No, I think it's amazing. And I think it's great that individuals like you outside the world of healthcare are connecting with therapists like me in the world of healthcare because I think you bring fresh perspectives, you bring a new set of eyes, you look at things from a different way in a different way. And I think it's nothing but valuable to help this integration happen between guys that understand tech and the individuals that understand humans.
Well, we're trying. We have a lot to improve, and we're making a myriad of mistakes ourselves. But like you, we hope to continue to lead with transparency and help others not to re-earn the same scars as
Yeah.
as we've gotten. And so with that, Tony, I want to thank you very, very much for being on this episode of The Disruptors, and I hope you have a wonderful rest of your day.
Thank you, Stephen.
Thank you for listening to another episode of The Disruptors. I hope that you were able to take one or two things away that you can apply immediately to your own innovation journey. As always, I'm your host, Stephen Cohen. This is sponsored by SaRA Health. Let's keep moving.